Welcome to our lecture on the MOA and the pharmacologic effects of the cholinergic agonist. At the end of the lecture, students must be able to have an understanding of the pharmacological actions or the MOA and the pharmacological effects of the cholinergic agonist. For the direct acting cholinergic agents or agonists, they have more affinity towards cholinergic receptors, and once bound, they are not easily removed by the enzyme acetylcholinesterase. So unlike acetylcholine, most of the direct-acting cholinergic agonists are more resistant to degradation of this enzyme because of structure-activity relationship. Their chemical structure has endowed them the ability to resist the degradation of acetylcholinesterase. Hence, these drugs are bound for a longer period compared with acetylcholine and produce pharmacological response like that produced by the acetylcholine. Let's now proceed to the individual pharmacological actions and effects of the direct-acting cholinergic agents. So again, most of these drugs in this category are considered to be selective for muscarinic receptors, hence produce muscarinic action. So let's take their effect on each organ, starting with the heart. For the heart, they produce inhibition through the M2 receptor. So again, the M2 receptors is inhibitory in nature. They decrease the heart rate, resulting to bradycardia, or the rate of contraction, decrease in the force of contraction, and decrease in the AV conduction. Proceed to the smooth muscles. We can easily remember that all the actions on the smooth muscles are mediated through the M3 receptors. As M3 receptors are coupled with IP3 in the DHA system, they always produce contraction. It is also important to remember that all smooth muscles are contracted by the cholinergic agents or the direct-acting cholinergic agonist, except for the vascular smooth muscle. So cholinergic activation of the muscarinic receptors on the vascular endothelial cells will increase nitric oxide, which diffuses to adjacent vascular smooth muscle cells, resulting in relaxation or smooth muscle relaxation and vasodilation. Hence, muscarinic agonists in the smooth muscles can act on the M3 receptors that are present on the vascular endothelium and release the neurotransmitter nitric oxide, causing relaxation. Now proceed to the bronchioles. So what muscarinic agonists do in the bronchioles is that it will act on the M3 receptors to produce bronchoconstriction. They can also increase the bronchial secretions, and all of these are important in patients with asthma or chronic obstructive pulmonary diseases. These drugs can produce GI smooth muscle contraction, leading to increase in the GI motility. This enhanced motility may result in diarrhea. But this condition or this action can be taken for advantage in patients with decreased GI motility. In particular, betanicol can be used in this condition. In the urinary bladder, these drugs increase the tone of the bladder, leading to increased frequency of urination. This is useful in patients with bladder hypotonia, where betanicol is prescribed. There are two important muscles on the eye that are affected by cholinergic drugs. These are the constrictor muscle and the ciliary muscle. For the constrictor muscle is also known as the circular muscle. And when it is activated, it produces pupillary constriction or meiosis. So you can imagine that if a circle constricts, its radius also decreases. Similarly, by constriction of the circular muscles as seen in the figure, the pupil size will also decrease. Hence, these drugs produces meiosis or pupillary constriction. So as shown in the figure, now this is the diagram of a constricted pupil versus the dilated pupil. So the muscle that is responsible for constriction of the pupil is the circular muscle or the constrictor muscle of the eye. So as you can see here, the pupil decreases in size because the circular muscle is constricts now the eye. Now let's see the effect of the cholinergic drugs on the second muscle, that is the ciliary muscle. Muscarinic agonists produce contraction of the ciliary muscle, leading to bulging of the lens. This is required to see the objects at different distances. So the diagram shows what happens when a cholinergic agonist acts on the ciliary muscle of the eye. So this is what happens. The ciliary muscle contracts, leading to an accommodated lens. The lens becomes more spherical in shape, resulting to a greater focusing power. The final effect of the contraction of these two muscles improves the drainage of the aqueous humor. This results in a significant reduction of the intraocular pressure, which is useful in the treatment of glaucoma. Pilocarpine is a drug specifically indicated for glaucoma as it produces a reduction in the intraocular tension. So how do we define glaucoma? So this diagram shows a normal eye versus an eye with a glaucoma. So when we say glaucoma, that is a chronic progressive eye disease caused by the damage to the optic nerve. So as you can see here, we have here the optic nerve. We also have here the, of course, the lens, and we have here the trabecular meshwork, that contains the canal of Schlem, where the aqueous fluid is being drained. So in glaucoma, one of the major risk factor of developing glaucoma is the eye pressure. An abnormality in the eye drainage system can lead to the build-up of the fluid within the eye, causing excessive pressure that causes the damage to this part of the eye, which is the optic nerve. For the exocrine glands, cholinergic agonists increase the secretion of the exocrine glands by acting on the M3 receptors. They produce lacrimal secretion, bronchial secretion, and salivary secretion.